Alright, so hi everyone, my name is Shriya Iyer, and today I will be talking to you about social media addiction. So to start off, a little bit about me. Currently, I'm a rising senior at Munster High School in Munster, Indiana. Some extracurriculars I'm involved in include speech and debate, student government, orchestra, tennis, and science Olympiad. I also volunteer at my local hospital, and my ambition is to study medicine and eventually become a physician. So as we may all know, the whole world is currently paralyzed by the COVID-19 pandemic. But I'm here to talk about another global health crisis that is quickly creeping upon us. And unlike other crises such as obesity or the opioid crisis, its effects are largely invisible. And that is specifically the social media addiction crisis. So social media addiction is quite easy to define. If one spends most of their time on social media, such as Facebook, Twitter, Instagram, Snapchat, or TikTok, to the point where they document each and every aspect of their life on any or all of these platforms, they would be considered a social media addict. Internet addiction and social media addiction have been satirically labeled as a disorder for over 2 decades. But as of late, this addiction has been given serious attention from many mental health researchers and public health organizations as a truly debilitating disorder. So, though not officially recognized as a disorder in the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, social media addiction's prevalence in American and European cultures is staggering, affecting up to 8.2% of the general population. However, some reports suggest it affects up to 38% of the general population. The widely variable difference in prevalence rates might be contributed to the fact that no true and standardized criteria have been selected. It is researched differently among scientists and mental health professionals, and it is researched differently across ethnic cultures. So emotional symptoms of social media addiction include depression, anxiety, and isolation. And physical symptoms include insomnia, poor nutrition, and poor hygiene. So the majority of us are probably on social media, and we are all innately aware that it is a double-edged sword. Social media platforms have given young people powerful tools for self-expression and community building, but it has brought with it a lot of unintended consequences, specifically mental health effects. So the mental health evidence now is pretty indisputable that the heavy use of social media is linked to mental illness. According to a survey done by the Royal Society for Public Health in the United Kingdom, people aged 14 to 24 reported that Facebook, Instagram, Snapchat, and Twitter have detrimental effects on their well-being. They reported that the platforms increased anxiety and depression, deprived them of sleep, exposed them to bullying, and created worries about their body image and FOMO, the fear of missing out. Academic studies have found that these problems tend to be particularly severe among frequent users. So the diagram on the screen displays the results of the survey and shows the dual nature of social media with both its positive and negative attributes. Engineers who have worked at companies such as Facebook and Instagram have admitted that social media platforms are also designed to be addictive. Sean Parker, Facebook's founding president, has admitted that Facebook works by exploiting a vulnerability in human psychology. Indeed, an experiment by 5 neuroscientists in 2014 concluded that Facebook triggers the same impulsive part of the brain as gambling and substance abuse. Yet it is difficult to prove that obsessing over likes and comments causes mental illness rather than the other way around. The most convincing effort was a survey that tracked a group of 5,208 Americans over a 2-year period, and it found that an increase in Facebook activity was associated with a future decrease in reported mental health. So to understand how social media can affect one's happiness, we can compare it to a bag of potato chips. When you eat a little, it feels like an indulgent pleasure, but when you start to eat the whole bag, you are guaranteed to feel miserable afterwards. We can see this occurrence in a study done by Moment, an activity tracking app, which pulls its 1 million users each week to see whether they are happy or sad with the amount of time they have spent on various platforms. In their study done from April to May 2018, nearly 63% of Instagram users reported being miserable, a higher share than for any other social network. They spent an average of nearly an hour per day on the app. The other 37% who were happy spent on average just over half as long. The happiness rate is much higher for platforms such as FaceTime, a video calling app, and phone calls. Therefore, when it comes to social networking, actual conversations are hard to beat. The chart on the screen shows the general trend that the more time you spend on social media platforms, the more sad you become. With the rise of the COVID-19 pandemic, we've also seen an accelerated use of social media. Doom scrolling, the tendency to scroll through and seek out bad news that is saddening, disheartening, or depressing, has become a new word in the American vocabulary and has also become popularized during this pandemic. In fact, Merriam-Webster added doom scrolling to its words we're watching list. For many, myself included, it has become an irresistible urge, in part because we're stuck at home, spending too much time on our phones, and also because that's precisely what social media is designed to do. So why does doom scrolling actually occur? We can look to 4 different reasons. First, it has to do a lot with our primal instincts, said experts. Our brains have evolved to constantly seek threats. That's why we seem predisposed to pay more attention to negative than positive things, because we're scanning for danger. Second, distressing news puts us on high alert, and the sheer volume of it on social media also keeps us poking at our phone screens for hours on end. Third, negative news isn't just getting a human boost, it's also enabled by the underlying technology. The interfaces of social media apps are designed specifically to get us hooked. Algorithmic systems are designed to take and amplify whatever emotions will keep us watching, especially negative ones. Finally, the sounds of our smartphones, pings, chimes, vibrations, and push notifications lure us in to peek at them by activating the same neural circuits in our brains that activate the flight or fight response. But now we are being hijacked by those same mechanisms that once protected us and allowed us to survive for the most trivial pieces of information. So just as there are healthy and unhealthy ways to eat, there are daily decisions about the use of technology that add up to major health choices. Social media should be used in moderation. Just as we practice restraint, such as by cutting our calorie intake, we can also make a conscious effort to reduce our addiction to our smartphones and social media. By acknowledging that tech companies are essentially tinkering with our biological responses to incoming danger, we can reclaim control by turning off push notifications and only answering texts and emails during specific times of the day. The solution to social media addiction could lie in adopting what Cal Newport, a professor at Georgetown University, calls digital minimalism, minimizing the use of electronic devices to a bare need-based minimum. Newport says that digital minimalists are the calm, happy people who can hold long conversations without glancing at their phones. The over-reliance on social media for instant recognition has started affecting the ability to forge relationships, simply because social networks celebrate virtual relationships. While complete social media disengagement may be far from feasible in the age of social media, we can try and restrict the time spent on social media to free up time for other activities. Much like any other addiction, the digital addiction needs to be reduced slowly, not in one go. So how can we go about this? In this age, pretty much every solution comes as an app, not very different for digital minimalism either. These apps have interesting names, such as Antisocial, Social X, Stay Focused, Usage Safe, and many others. All of these enable you to set limits on social media usage, and some even allow you to set limits on specific apps. In conclusion, the answers to social media addiction lie in shifting our engagement to the real world. Engaging in exercise, reconnecting with nature, and spending time with friends and family is a step in the right direction. So some acknowledgements. I'd first like to thank the Global Health Leaders Conference for giving me the opportunity to present today and talk to you all about social media addiction. I'd also like to thank my family for supporting me and helping me with reviewing and practicing this presentation. So thank you everyone for listening. If anyone has any questions, please feel free to reach out to me at the email listed on the screen.